Hello, all. Welcome to Engaging Volunteers During Recovery. This is one of our sessions that are part of the Volunteer Generation Fund, and that fund is made available through AmeriCorps, the agency, and Michigan received this grant to be able to increase the number of volunteers serving in Michigan. And one of the strategies that we use for that is helping nonprofits build their capacity to be able to utilize volunteers. And we certainly understand that the pandemic put a big had a big impact in the number of people volunteering. We're seeing across the state, the numbers of volunteers are shrinking in organizations, but certainly the irony of this is the needs are so much greater. And we do recognize that in the last couple of years, we've had some challenges with agencies being able to accommodate volunteers and agencies working, having employees working from home, out of the office, things like that. So we understand that there's been a lot of different changes. The idea behind this training is that it's about how we're going to engage volunteers going forward. How do you rebuild your volunteer programs? How do you reconnect with and recognize that things have changed for volunteers? So with that, we're going to just jump right into it. I did have a poll, but I think we're going to skip that for right now. And I'll introduce myself. I'm Melissa Sherry. I am the Volunteer Impact Coordinator here with the Michigan Community Service Commission, and I deliver quite a few of the trainings on volunteer management. I've been in volunteer management most of my career, which is now spanning close to 30 years. And it's been a wonderful journey. It's been something that we've seen lots of changes, but certainly the pandemic was one of the most significant changes that we've seen in service throughout my time in volunteerism. So we're going to go ahead and we're going to transition to one of our first slides. This one is about where do you start? And for many, we've had people challenged with, where do they even begin to look and see how they're going to reevaluate where service starts. So the first thing I always say is create a plan. And this is a process improvement diagram here. This plan, do, check, act. It's also called PDCA, if you've ever seen it before and you're like, oh, what is that? Plan, do, check, act. And most of the time, as Albert Einstein says, that he'd spend most of his time, thinking about the problem, and then 5 minutes in actually addressing it, the doing part. And so when you see this, what's interesting about this is most of the time should be spent in planning. And if you're thinking about it, you're like, oh, we've got this problem, you're on the right track. Maybe not necessarily jumping to a solution immediately, but to look. And then what we're going to do is we're going to help you kind of like, how do you start that planning? The doing is, like I said, a small part of this. But then once you do it, you want to check to see where things are going. I mean, are the strategies that you've employed, are they working? Are they getting you the results that you need? And then you're going to take action to address those. So just keep that in mind. Plan, do, check, act as you go through this. So I want to share some of our objectives. We're going to create a document. We're going to help you be able to create and document the plan to reintroduce volunteers into service. One of the things that we found is you really do have to plan for the unexpected, and then evaluating the need versus the risk for volunteer involvement. This isn't just their risk for, catching COVID. It's the risk to the agency. It could be on privacy matters. It could be on, what do we have to do to adjust things? It could be anything. So, but there will give you a platform for doing that. And then gaining support within the organization for a return plan or a relaunch, or a new recognition, a new recruitment avenue. And then also determining what the needs are for volunteers. We recognize that many times some tried and true needs are going to stay, But maybe there's some things that have gone away now, and maybe there's opportunities for some new roles. And we have some ideas and things that we're going to share with you that have really changed a lot during the pandemic. And then we'll talk about our recruitment, re-engagement, and retention strategies, also communication and updating training documents, policies, and your handbooks. And then how do you welcome back your volunteers? So with that, we'll just jump in. So where to start? Well, first of all, as we talked about plan, do, check, act, make a plan. And plans should always be flexible. We want you to use data to support when it's the right time for volunteers to work. We want you to think about what data is out there to support the need for a volunteer to be in a specific position too. Is it the time of day when it's busy? Is it the, is it your programs? I mean, are they dictating the number of people that are in your programs? Are they dictating what the volunteer the requirements are, things like that for support? And then I would also caution you, if you're really trying to rebuild, have a phased approach. Look at the most critical needs first and start there and see what you could do to fill those out, and then go to the less critical from there. And then plan ahead for various situations. It could be anything at this point. Volunteers, their lives are very different, after, post-pandemic. But COVID is still around too, to keep that in mind. I mean, we're still seeing people catching COVID, and maybe it's not as scary now because we have vaccines and we have medicines to make sure that we preserve their health and their life and things like that. There's still things that are happening. And then we want you to assess the risk where volunteers are needed, and then modify plans to keep people safe. That does not just include the pandemic, or where they could engage with someone who might be sick. It's everything from making sure that if you have policies in place, that they're not violating a policy, that it's for privacy, it's for safekeeping, things like that, to just in general to be good stewards of the resources and the reputation that your organization has. And then I would always, if you have access to this, or if you don't have access to this, there's some opportunities out there, and maybe it's a good volunteer opportunity to involve legal counsel and or human resources. They're always really good partners. If your organization is big enough and you have both of those, it's not a bad idea to ask. And then always check with your insurance carrier too. There may be some things that are not in your policy that do not cover it. So it's always a good idea to check there. I'll give you a quick story that I had a director who put in an insurance policy in place in an organization I had worked with. And I had one office, and all it did was protect the one office, but 99% of everything that we did was outside of our office. So we didn't do our due diligence on that. So fortunately, how we found this out was we did go to check before a day of service, and then that's what we learned. So it was kind of a useless policy until we really talked to the insurance carrier about what our needs were. So that is always a good thing to do. And of course, with this, it's not just an organization the volunteer coordinator or director has, it's also a conversation that you have with all stakeholders. And we'll talk more about that as we go along. So let's talk about gaining support and understanding the needs. As we just mentioned, stakeholders. Who are your stakeholders? Are they your funders? Are they your board members? Are they your community that you served? Are they your clients? Are they your employees? I would say all of those, and probably much, much more. You probably have other people who are supporters of yours. They may be your donors. They may be a sister organization. So understanding and determining and maybe even creating a list of who all of your stakeholders are. And then what are their biggest needs or challenges that exist for them in working with your organization? What do they see as the needs of your organization? Sometimes people outside the organization can be a big eye opener to listen to what their needs are and what challenges they see that you have. And it could be an opportunity to really grow from that. And then what stands in your way to overcoming the needs that you have? And this should be an entire conversation with not only your staff, but your board and your executive director. If he or she is in a position to bring this to the board, that would be good. So many times people say, oh, it's money, or they say, well, these things that you can't control. But, if you can find a way to facilitate that kind of conversation, I think that it's really eye-opening, and it almost will create your plan to help you find solutions to the organization's toughest problems, which I believe that volunteers can very oftentimes solve. And so what changes do you need to make to be able to uh, um, see those needs through? And you think about it, if you could change anything, I wonder what it would be. For some, it just needs to be changing your hours. Sometimes we do things that are easy for the organization, but they're not easy for our customer or our client or those that we're, trying to serve, whoever that may be. What's the consequence if you don't find a way to meet those needs or challenges? Do your funders maybe find other people to fund? Do your supporters lose interest? Are there other programs that are maybe better fit to meet your needs? And then, if you don't find a way to meet them, I mean, is there a plan to join up forces there, to consolidate? And then would there be support for volunteers helping meet these needs by creating new roles? And we've seen a lot of things happen more recently with skills-based volunteers, virtual volunteers, and remote volunteers. And I would say that there's more of a desire for volunteers to serve in those roles than there has so far been for agencies to be able to accommodate those kind of needs, even though their employees very oftentimes are working from home. So that's an opportunity for us. Here are some of the things that have changed since the pandemic has started. As I mentioned, virtual volunteering. These oftentimes we see them on Catch a Fire. We see them sometimes on our Get Connected page. But again, more volunteers are willing to serve in those roles than there are roles actually available within organizations. But it's a whole different way to look at volunteering. And then I would also suggest like a hybrid model of volunteering where you pair volunteers with employees. And now a volunteer should never supplant or replace an employee, but a volunteer and an employee can work side by side, and then that will kind of bridge the gap for an extra set of hands for the organization. But keep in mind, due to labor laws, you do really need to be conscientious of the employee's position description and the volunteers. The volunteer cannot do the same position, the same work as a paid employee, but they can do part of that work. So what it means is that an employee needs to have more and different work than a volunteer. The next thing is the skills-based volunteering. We're seeing, we're actually trying to launch now. I think Kimberly is on with us. We are trying to launch a skills-based volunteer platform. There's a great interest in this, and that could be anything from developing a fund development plan to fundraising to grant writing to helping with social media, things like that. We will help you develop those, and for positions that are pretty complicated or an organization that has not already gone into this, we will have some training available. I think Kimberly has her hand up too. What would you like to say, Kimberly?
Oh no, I was just acknowledging that I was on.
Oh
You
yeah,
covered.
yeah. Okay,
But
great.
in actuality, I prefer using we are launching the skills base, not trying. We are in full force getting it implemented. So it's happening.
Yeah. And do you want to explain where that's at, where the platform is at?
The platform will live on our my SIRS, what are we, Michigan Volunteers. That's where it will live. Currently, we are assessing our volunteers, and we will be reaching out shortly to nonprofits for projects. So if this individual, as they're going through, can think of possible ways to utilize a skills-based volunteer, have different projects that they may be interested in, or even need direction on, is this something that a skills-based volunteer can do? Please reach out to either Melissa or myself, and we can provide more information.
Absolutely. Great. Thank you, Kimberly.
You're
So
welcome.
then I would also think about those new positions, just, like skills-based volunteering, and how does that really help your organization rebuild and get you to a better place. So think about what those new positions could be. Some of them can be skills-based, some of them can be virtual, some of them can be, some of them just can be all new. And then I think this is another point, is how do you gracefully let go of positions that and maybe volunteers that have served for a long time. Sometimes it's just not feasible to do that kind of role. And some volunteers may or may not be able to transition to other roles, just due for a number of things. Whenever I have had to make those kind of decisions, I never made them alone. What I did was I always would contact those volunteers and I would talk to them about it. And I would always do a survey, especially if it's, in my situation, sometimes there were a lot of people, but even if it was just a conversation, what I would want to know is, how would this change affect them personally? What thoughts and ideas do they have about this? And how can we keep them as a volunteer? And if it is a and always ask, if it's a survey, do you want us to follow up with you? And if so, we need your name and your number. But when I've done this, it's almost been like, yeah, we're waiting for this change. We're okay with whatever. And then the change goes by smoothly. When I haven't done that, however, it has been a very painful transition. And what I mean by that is that painful in terms of volunteering is very personal to people, even though things have changed for them. If they're in those roles and we can't do those roles, we're not going to support that anymore because we have other demands. I feel like it's one of those things to ask them what their thoughts are on this and involve them in the process. So do this change with them, not to them. So with that, recognizing that volunteer has changed quite a bit. One thing the pandemic has done is it has raised the red flag of everybody wants flexibility in their work. Employees want flexibility. Volunteers do. There's other things that they could be doing with their time. And chances are, if they were your current volunteers before and they're just getting back into it, or they've had a break, things have changed for them. Maybe they have other commitments now. So these are some of the things that people either want flexibility with, or they have as things that are opportunities for agencies to be able to to be able to recognize and to be able to figure out how do we work with this. So the hours, sometimes we talk with agencies that only do something on a Tuesday between this time, and it cuts out a whole lot of people who are working. It cuts out a whole lot of people that could be receiving their services, but also those who could be serving. So think about your hours. I mean, how flexible can you be on your hours? How flexible is it that someone needs to be there? Looking at the overall time commitment in an organization I worked with, we were asking for at least a 1 year commitment. And I don't think a 1 year commitment is that long of a time, but they have different lives now. I don't know. I haven't asked volunteers that, but one thing that we notice with our Get Connected opportunities are short-term commitments, like project-based short-term commitments, seem to be very popular with volunteers. And volunteers are doing a lot of different things now. So, and they have other responsibilities. This advent of people quitting their jobs and doing like side hustles, they're really scheduling out their time and they're doing different things, but they would like to volunteer as well. And so think about what they're, asking specifically what other responsibilities do you have? And how does volunteering fit in? I mean, it's a great question to ask your current volunteers just to really understand where they're at. So then the other thing is a lot of people are traveling a lot more. I know I am. I know Kimberly is. We both are contractors. We work from home. It's hard to give that flexibility. But to think about that with the amount of travel that people want to do, how can you still accommodate service in there? Is it a weekly commitment? Is it a twice monthly? Is it a project based? How much can they do on their own? Things like that. Childcare is another piece. And, is it at all possible to provide childcare? Is it possible to allow someone to bring their child in with them? What are the opportunities? And then transportation is another thing. Transportation, many times someone's working from home. They are now taking, public transportation. In some areas in Michigan, that's easier than others. But by and large, most people do tend to, rely on their vehicles and things like that. Is transportation an issue? For me, on the other hand, sometimes it is, sometimes it isn't. But the bigger one is like caring for other family members. We're seeing lots of grandparents taking care of their grandkids, like after school, before school, things like that. And then also having the impact of caring for other family members, such as a spouse, a parent, things like that. And there's been a big increase in the number of individuals caring for parents, actually. It was something that I had seen recently, and I was a little surprised by what that looked like for people here in Michigan. So on the agency side, being more flexible about the services that are offered, offer perks such as it could be free parking, it could be free bus tokens, and allowing family members to serve together. You do have to be somewhat careful about that because there are some labor laws that get involved with youth volunteering. And if they were to get hurt, things like that, even with a parent, it is not, it doesn't matter if a parent is there. I would always recommend checking with the labor department, our state labor department. They're very open with you and they're not at all punitive when you're asking ahead of time, things like that. They'll give you some great guidance on that. So if you have some ideas about how you'd like to do that, talk to them. And then allowing for work to be done at home. What do you have to do for this? Is it, with so many employees working from home, are there ways to have a volunteer do projects and have those check-ins, things like that, that are more virtual based? Just because maybe your office, everyone's working from home, doesn't really mean that you can't use volunteers. I would have that conversation. And then again, allowing for that virtual service, allowing for short-term assignments, and like, hey, we're having this, or, I would like to see, XYZ happen for 3 months. Is that something where you could help us out? Having people help when your snowbirds are away, I think is another great way. And then I talked about this briefly, but not having staff do all the same work as a volunteer, but creating that staff volunteer hybrid model so that staff are supporting the same things, and then the volunteers are just filling in, to support those efforts. And that has had to happen in a lot of agencies just because of the way that things turned out with the pandemic. We had shutdowns and things like that so early in the pandemic. It probably feels like it's in everyone else's rearview mirror, but for many volunteer organizations, they've had some challenges in recovering from that. So I wanted to share this too. These are some of the most innovative volunteer roles that we're seeing coming available. Advisory roles. This is a great way to look at clients, look at stakeholders, look at your funders, whoever those people may be, that could provide some great advice in how you reshape your volunteer, your services, and also your volunteer program. Asking clients, what do they see? What do they recognize? There was a saying called perception is deception. And when you perceive that things are just great, you may find from your clients, you may find from those that you serve, that things are not as you thought they were. So you could have some room to grow, some opportunities there. And always hearing from and including the voice of your client is always a great way to get that. Evaluating your organization's vision, your mission, vision, and values. How do those volunteer roles support each of those? And to be really clear on the impact that volunteers are making, this is an opportunity to go back and look at your position descriptions and see how you are describing the impact. People volunteer for things that move them. They don't volunteer for an agency or an agency name. They volunteer because they want to make an impact. And then I would really highly encourage everyone to look at younger volunteers, those people that are leaving college, getting jobs. They are volunteering and giving in increasingly large numbers. They are not going to be those that are just putting time in a seat. They want to help serve in different ways. And they want to volunteer for causes and tasks that are ending a community need. For example, they would like to not just pass out food, but they would also like to make sure that they end hunger. So what are those things that could end hunger? It may be things like community gardens, learning how to can, learning how to do things around your house to make sure that your your dollars are going further to be able to save on utilities, things like that. So they want to do things that end the problem, not just, okay, like I fed you today. They want to make sure that that person has the ability to sustain their food supply. This is the other thing too, is older people are having more physical issues. Are you able to accommodate those needs for maybe needing to sit, maybe to get up and walk, being able to do things sometimes from home, maybe, not always being able to be there like we thought they were going to be. These are some of our steady volunteers. This weekend, I ran into a lady that I had volunteered with for quite a long time. And she had volunteered for our organization for quite a long time. And she shared all of the challenges she's had since the pandemic started. And I don't even know if she ever got COVID, but all those physical issues. she was working in a gift shop and they had to stand. Well, she couldn't stand. I mean, it was even hard to get to the gift shop because of how far away it was. So what kind of accommodations could you put in place to be able to make sure that individual could continue to serve? And a big part of it is they have a lot of friends that they volunteer with. So that could be part of it. I mean, can you have a friend help a friend, et cetera, et cetera. So many parents are also still working from home. And, how do you meet their needs? They want to be out in the community. They want to be with people. They want to be able to interact. And then maybe, but they still have a challenge of, their children too. So opportunities that build on social connections are always very positive. They're always ones that get people to get people out. This last weekend, following the unfortunate shooting that they had at MSU, there was a big Spartan Family Day, and people came out with their dogs. People came out with treats. They came out with different things. I was a part of a group that were moms, and we were mom huggers. And so we gave out hugs to students, and we gave out lots of hugs to mom and dads too. But it was the impact that, we shared, that we cared about them, and we shared resources with them. The idea was about the impact that we needed to let them know that their community cares about them. And they're, even if their mom couldn't give them a hug, there was a mom that was there to take care of them in that moment. So think about what the impact of that is, and how that plays in your roles. For many, it's still skill building. We saw this a lot when the economy went really bad, that people were looking for career changes. They were looking for building skills. They wanted to transition from a volunteer to an employee. And I think that's always a great idea. If you've got a great volunteer, can your agency do that? We have some agencies that say, we have $20 an hour jobs. I can't find anyone to fill that. And my challenge would be like, well, where have you looked? Can you train that person? Can you build them up as a volunteer and transition them into a paid role if you see a great fit? I would look at all of those kind of things. And we still have a lot of people who are doing career changes, and they're going in a different direction. And instead of doing one job, they're doing 3 jobs that make up for that lost income, but they're things that maybe they're passionate about. What kind of ways can you encourage people to come to you, serve, and also be able to accommodate that career change and learning? Then here's the other thing, and we'll talk in a minute about like, how do you stage this, but look at timing and evaluation of risk. I'm not going to spend a lot of time on this because I think maybe we've moved past it, hopefully, but just keeping in mind, if we have a big insurgence, this is where sometimes that planning has to come into place, where, maybe you still do look at metrics. Maybe you still, I would always say, modify the roles based on what you're hearing from your stakeholders, what you're hearing from your community in terms of the capacity of volunteers to be able to serve. Do you need PPE, and do you need to do training on that? That, I guess, it depends on your organization and what they're doing. But obviously, communication plans through all levels of the organization are always critically important in any kind of change or planning that you're doing. I think that's always the biggest thing. I still have this in here about updating your COVID prevention strategies. I think you should still have these things. If you don't now, these are a few of the things that you can look at. Community spread, how impacted are your hospitals and your physicians in the area? How many people are getting the vaccine in your communities? looking at the early detection of COVID and with self-testing and things like that, I think that's changed some. And then looking at the populations most at risk, this was a big reason why many shut down, and they shut down volunteers. So a lot of our volunteers were older people, but not always. But looking at, looking at who is most at risk, I think this is still very valid because I've at different times during my career in volunteerism, we've looked at different things like the avian flu. There was one with a bunch of letters as well, and it actually impacted youth. So for a while, we had to shut down our youth program. It was never something that we were terribly concerned about in the community, but when you're bringing, in that case, sick people together, and you know that there's a chance that a young person could contract something, and maybe they were a minor in our case, that's why we did that. So keep that in mind, but that's always a good thing to look at, and you can apply that actually to any kind of big illness that's coming along, which tended to be kind of those flu things that we've experienced in our lifetime. Okay, so taking a look at the volunteer numbers and needs, developing our own volunteer and staffing, volunteer and staffing matrix. We're going to show you that in just a moment. But this will help kind of plan out when things happen, and it'll help you develop your strategy for where you focus your recruitment, where you plan for volunteers to be involved, things like that. And part of this, a big piece of this, is determining what are the priority roles and what are the target dates. If you have something new, Kimberly talked about the skills base. We are actively doing that right now. And we have dates that we want to meet certain things by. And we did this much the same way. There's a whole plan that goes along with it. Addressing any policy changes that are impacted by COVID. It would be wonderful to say we can just put this all behind us and forget about it. But we know that is not possible. And we should still have those policies in there to be able to address it should we need to. And then the other thing is, and this goes right back to that hybrid model of staffing and volunteering, and having, confirming the support and the availability of the team to train and supervise newer returning volunteers to help them get up to speed and onboard them is critically important. And then if needed, that PPE, and then anything that's different, with training, if somebody is new, have all those training documents put together. And one of the things that I do with training documents, just so you're aware, I tend to do a three-part process. The first thing I do, is that I have information written down, and I'll even go as far as creating a flow chart. So if no one has ever been trained before, they could muddle through the shift with this, but we would never put someone who is not trained in a position, right? So I usually will put that flow sheet. I will put a frequently asked questions. I'll have scripting available. I'll have a to-do list, like this is how this is done, that kind of thing, and why. And then what we'll do is we'll go over that written document, and then we'll bring that individual in, and then they could observe seeing it. And then they have a third time that they will go with someone, and someone will show them, and then they'll have an opportunity to be observed by someone who is well trained and make sure that they're helping and supporting if there's anything that they need to change. So what it does is it addresses not only your learning in terms of, some people are visual learners. They need to see it and experience it. That's probably one of the best ways I learn. They can also read it, and then also they're hearing it. So, and then they're seeing it, hearing it, and seeing it, and then doing it. And then this goes back to making sure that you're aware of any kind of rules that are in place. There's sometimes there's still rules that there are federal rules about youth, but we had some state rules for a little while that that youth volunteers could not be in, like in a healthcare setting. So, looking at whatever those are at the time and just being aware of them. I know that many of those have been lifted right now, but just so you're aware. This is that staffing matrix that I was talking about. So you see in the first row, those are the positions, and a level 1, 2, or 3 are the priorities. Level 1 is the most important. Level 2, somewhere in between. And level 3 is, that's less of a priority. The matrix, these are the things that, what is it that will, when are you ready to do this? Is it when the vaccine's available, which it is now, obviously, when students are available, whatever it might be. And then calculating your hours, and then the number of shifts that you need every week, and then deciding on a potential return date. Obviously, these are a little older, but you can look at this, and even if you're planning for all new positions, having this and understanding how many volunteers you need, how many shifts you need, and what's realistic, and then asking those staff and stakeholders, I mean, does this make sense? What do you think of these? And then what kind of training or personal protective equipment needs to be in place? Thinking about all these, make sure that volunteers feel comfortable and safe when they're there. Even now, like those plexiglass screens are still being used. They're still very important to help control that potential exposure for our staff and our volunteers. And then who is it that's going to do what? Who's responsible for helping this person? Is it the training piece? Is it making sure that they have their equipment? Is it making sure that certain things are in place to keep them safe? Whatever it is that you need for that person, and you have a staff person who could do it, or you need it, it identifies a need for you. So the other thing I would do is a lot of checking in with existing volunteers. I would survey existing volunteers about their comfort level. How are things going? If you're recently getting them back or they've been back all the way along, just check, constant check-ins with them, I think is always a good idea. And I don't mean constant, but I mean regular check-ins. And especially if they are remote or virtual, you want to be able to have like an opportunity to do a check-in and just make sure that things are on track. If they're, asking if they're willing to help with a new need or an emerging need that your organization has. And, one of the most powerful things is asking if they could help recruit new volunteers for the organization. And what's interesting about this is that you will have to recognize, if you're looking for more diversity, that's not usually the way to go. But current volunteers do tend to help us with recruitment. They bring their friends in and things like that. If they have a good experience, they're talking about it, they're thinking about somebody else who could do this with them. And what I would say also about this is that generally people know people that are like themselves. So that's why, I mean, if you're looking to increase your diversity, you're going to have to look at different ways. And I, for example, worked with our diversity and inclusion specialist. But if you have organizations that are in town that have those and your organization doesn't, check in with them and become friends with them. They will refer people to your organization left and right. I always had such great success because those tend to be positions that are out in the community, very front facing, very supportive of developing professional skills in different populations. And like where I live, we actually have a lot of refugees that come here, and they are people that sometimes they know the language, sometimes they don't. They're learning the language, things like that. But through those contacts with those inclusion folks, it's been incredible the number of people that have been recruited and placed within organizations, not only as volunteers, but also as employees. So think about that. If you don't have that position, see if you find some other organizations and then just become friends with them. And look on LinkedIn, for goodness sake. That's also another place. If a volunteer has decided to leave or you've had to retire them because of various things, you celebrate their service. This is always a way to really help solidify the relationship between the volunteer and the organization and keep that on a positive level. I would always very oftentimes, especially if I had short-term assignments with like maybe a skills-based volunteer, I would always write a letter of appreciation to their supervisor, or a letter of recommendation that they could use for future employment, things like that. So I think that those are always very important. Being able to, if they're active on LinkedIn, being able to support that person with a recommendation is always good too. And then if a volunteer that you're coming across is feeling unsafe, or they're trying to figure out how can they fit volunteering in to this complicated equation of their life, one of the things that I would do is I would just sit down and talk with them. And, maybe it's not right now, maybe it's a month from now, maybe it's shortening the amount of time that they are spending with you, things like that. Whatever you could do where you could still get the benefit of a volunteer, but maybe make it so that it's possible for them to serve, I think is always a great idea. And then keeping communication positive and very open. If there's other changes that are happening in your organization, being open and honest with them about what will change, what will not change, that tends to be the kind of questions that they have when changes are coming along. And what kind of support that they'll have. In general, and this is like whenever, obviously, same with those check-ins with volunteers, communicate when that person is going to be trained on the new responsibilities and safety protocols. This is a question that is very common. And even if you feel like, we're over COVID now, to many individuals, they're not. And they're still taking extraordinary, precautions to make sure that they do not catch that. So, and then, decide what is required. I mean, do you need to have personal protective equipment? Do you need to have these things? It's probably always a good idea to have the gloves and sanitizer, making sure that people are using those things appropriately, especially gloves. They can be kind of tricky, and if you don't know how to use it, make sure that you do ask. But if people are using that kind of stuff in your organization, make sure they're doing it safely. And then we talked about the plexiglass, things like that, and the storage and our signage and distance reminders. I would still be cognizant of that. Like when you have meetings, when you're setting up a volunteer workstation, I would still be cognizant of that and redesign or move volunteers around so that they can't have that social distance. And then I always stress scripting. I know I mentioned that briefly a moment or two ago, but how can volunteers safely interact with the public? And what does that look like? What do you want them to say? What do you want them to not say? Can you provide them with some sample scripting, and can you coach them on that? I think that's always an important thing, to be able to maintain the image of the organization and do it in a positive way. And then always offer training. It could be, like I said, when I had them read it, do it, see how it's done and then have them do it, that preceptor idea, I think that's still very valid. And then offer support with lots of check-ins, offer reassurance and communication about your openness to answering questions, things like that. I know we talked about this briefly, but in terms of altering roles or getting rid of roles, always involve those who are closest to the work. And like I said before, don't do this without their input. And it is always personal to the volunteer. I think that is really consistent across the board, because sometimes it is about them and they have some certain needs that they have that you may not be aware of. Always being respectful, honest, and open with them, and then being positive about it, and then sharing that you're appreciative of the volunteers' input and the communicate any anticipated changes that you would expect to have. And then many times when this is done well, the change is almost like, okay, yeah, we've been waiting for this, but talking to them about what they see as the challenge and how it does impact them, I think is always a great way to really solidify a solid relationship with volunteers. And it's always a good idea on any safety or any timetable that you choose, but updating your policies and procedures and training. As you're reintroducing volunteers, or you're going to try to rebuild, this is a great time to do that. You want to make sure that those new policies are written out, and you're rating each area's exposure to COVID-19. I think that's still very valid. And you're creating those new position descriptions and understanding what the cleaning protocols are and making sure that's in your regular training for volunteers. And then how volunteers can interact safely with others, and then determining who's going to do that, in that staffing matrix that we talked about, and then having volunteers acknowledge the following guidelines and having them use PPE correctly. There's a lot of ways that you can misuse gloves, for example, and people don't always recognize that. So that's why I share that. The communication, here's just some ideas here. Updating your website with all of your volunteer roles on it is always a good idea. If you should check also in the Michigan Volunteers website, which is our nonprofit guide, to see if you're in there. If you're not, we'd like you to follow the instructions about getting added in there. But it would be a good idea. And you can also update information there as well. Offer easy to understand documents that create those safety protocols. And then your social media campaign to re-engage volunteers. So many volunteers are learning about roles through social media. And then creating your frequently asked questions for, whether it's, volunteerism, whether it's a new position, whatever it is, have that available. But for those that are appropriate, put them on your website. And then, having some temporary automatic emails that you could bring up to be able to respond to questions, things like that a volunteer may have, would be a great idea. And that all falls under your planning. And then so does the scripting, and then planning for the regular updates with volunteers during email, and then celebrating them on social media. I tell you, whenever you can recognize a volunteer in a way that is consistent with what they would like, and maybe that is another question you have for them, is how would you like to be recognized for your service? I've had people say, just never take my picture. I can respect that. That's okay. So develop your communication plan, and then make a big splash about volunteers when they come in. Make sure that people are aware, hey, at 2:00 today, we have new volunteers coming in, and make sure that when, right from the front desk, when they ask to see you, or they, come in for their interview, that people are aware and they're looking forward to meeting them, and they're looking forward to saying, hey, welcome back, or welcome. And then, sorry. And then the last thing I want to share is, think, is your organization ready for volunteers? Is your facility ready? Do you have a place for them to work? Do you have a plan? Do they need to be vaccinated? Think about all those things, and then creating any visual reminders you have to help support them if they are going to use any kind of PPE, things like that. So thinking about the little things, making sure they have a place to park, making sure that they have a place to put their coat, making sure that they have a safe place to store their purse, things like that. Those are all things about getting your facility ready and making sure that when people come into your organization, that they feel comfortable, they feel like, they've thought about these things. Those little things tend to make a huge difference. So with that, I'm at the end of my program, but I can send out the example of the staffing matrix, and I can answer any questions any of you might have about volunteerism. I think that we only have a couple people on right now, which is perfectly fine. But are there any questions? I'm going to actually stop the recording now too. But if you, Evan, if you have questions, you can just unmute and ask.